Hello, dear friends and colleagues. Today, I'd like to talk about another topic which is very important for exam, though practically we'll get uh, rarely this case. And examiner love most again, and candidate don't like to study this topic, but you will get one question from here definitely. I'd like to clarify and I'd like to give concept so that you can differentiate and you can easily have an idea about this disease. This is autoimmune polyglandular syndrome. It is usually less studied in the graduate level, but postgraduate level it is an important topic. Okay. So, autoimmune polyglandular syndrome, another name is polyglandular autoimmune syndrome, APS. It is autoimmune. Polyglandular means multiple gland involvement, though it is misnomer because a polyglandular involvement not always right. Sometimes non-glandular involvement are also there. So basic thing is that any autoimmunity will destroy the functions of the involved organ. So you will get hypofunction or non-function of the involved organ. So here actually basically multiple gland involved. So you will get multiple glandular hypofunction. So in our body, you know that there are multiple glands like thyroid gland, parathyroid gland, pancreas, adrenal gland, pituitary gland, ovary, testes. These are the endocrine gland. So these endocrine gland can be involved, and you will get uh, multiple hypofunctions of the involved gland. So there are combinations of this involvement of the gland. It is two type, APS1 and APS2. So just remember 2 is bigger than 1. So all the bigger and major functioning gland will be involved in APS2 like thyroid gland, pancreatic gland and adrenal gland. And as 1 is smaller than 2, so all smaller gland will be involved in the type 1 like parathyroid gland, adrenal gland again, small gland. Adrenal gland actually common in both APS1 and APS2. And here specifically in the type 1 you will get mucosal candidiasis. So in APS1, when you'd like to diagnose, at least 2 involvement will be necessary. So 3 involvement I said, mucosal candidiasis, hypoparathyroidism and adrenal insufficiency, Addison disease. Addison disease must. So in with Addison disease, if there is mucocutaneous involvement, it is APS1. Or in Addison disease, hypoparathyroidism there, then it is APS1. APS2, hypothyroidism, again Addison disease, and type 1 diabetes. Okay. Now I'd like to talk about APS1 and APS2 individually, separately. Before that, another thing I said that 2 is bigger. So you just remember onset of APS2 also will be in the adult age, around 30 or 40 years of age, and APS1 smaller, So onset will be in the childhood, adolescent, or before that. Okay. Now I'd like to talk about APS1. APS1 is autosomal recessive condition. So in exam there will be question APS1 autosomal recessive or dominant, or X-linked recessive or dominant. Your answer will be autosomal recessive. Where is the mutation? Mutation in the 21 chromosome, and the gene is ARE gene. That is autosomal autoimmune, A for auto, I for immune, autoimmune regulatory gene defect. So it is autosomal recessive 21 chromosome ARI gene. So from here you can get one question. Okay. Now how will present this? Before that, I just like to say that there are other name also autosomal. This is APS1. Another name is Whitaker syndrome. Whitaker syndrome, and this mucus candidiasis, hypothyroidism, and addition disease. It is a Whitaker's triad. So Whitaker syndrome. Another name is APECED. AP is autoimmune polyendocrinopathy, APE. C for candidiasis, E for ectodermal, D for dysplasia. So here also they gave sign symptoms. So candidiasis will be there, and ectodermal dysplasia. So you have to know that ectodermal origin, skin or in ectodermal origin, teeth ectodermal origin, here ectodermal origin, tympanic membrane ectodermal origin. So tympanic membrane dysplasia will be there, teeth dysplasia will be there, skin involvement there, and alopecia due to hair involvement. So alopecia, vitiligo, conductive type of deafness also will be involved in APS1. But in exam probably will not get like that. You'll get the symptoms of addition disease and symptoms of oral candidiasis or esophageal candidiasis or candidiasis nephirash, early onset. You have to think APS1. So how will you investigate this question? So before that, symptoms I'd like to discuss symptoms. So oral candidiasis, how will present to you? Patient in the early age, before puberty, will give oral candidiasis. This is the first presentations of APS1. Oral candidiasis will get, sometimes you'll get retrosternal um, pain, so esophageal candidiasis. Sometimes you'll get abdominal pain with diarrhea, intestinal candidiasis. Sometimes you'll get around anal colon, there will be skin involvement, and also labial candidiasis, diaper rash. So candidiasis will be present like this. So you will get candidiasis because there are some T cell abnormality. So cell mediated immunity will be less. For that reason candidiasis occur. Okay. Now hypoparathyroidism. This autoimmunity destroy the parathyroid gland, so we'll get hypoparathyroidism. Feature of hypoparathyroidism also, after candidiasis you will get, patient will get tetany. You will get tetany or seizure. So because of hypocalcemia you will get this feature. And addition disease, adrenal insufficiency. What will get? Postural hypotension, abdominal pain, skin coloration, discoloration, and you will get some investigation will get sometimes hypoglycemia, and sometimes you'll get the features of hyponatremia, hyperkalemia. We'll get like this, that additional features. I'll talk about addition disease afterward. Okay, so when you will get 2 out of 3 white thicker stud, it is APS1. How will investigate? Oral candidiasis, you can get anything by doing taste. It is clinical. Then for hypoparathyroidism, you just parathyroid hormone, calcium, vitamin D, you can see, and phosphate level. So parathyroid hormone will be less, calcium will be low, phosphate will be high. Addison disease, cortisol level will be low, morning cortisol level, acetase level will be high. Okay, and you need to short synactin test. So this test will be done. How will manage? The mucus candidiasis managed by oral antifungal, fluconazole, and hypoparathyroidism managed by calcium and vitamin D supplement. Addison disease managed by, in acute case, hydrocortisone, and in normally then when it will be settled, you can give prednisolone or hydrocortisone plus fludrocortisone. Medica alert bracelet can be also given. Okay, so patient will APS1 can come in different way, can present. Now APS2, patient will give the symptoms of hypothyroidism, cold, intolerance, constipation, weight gain, rough skin, low mood, bradycardia. So this type of symptoms will be there. Addison disease, again Addison disease additional features will be there. And type 1 diabetes, patient blood sugar will be high and patient is on insulin, something like that. So they'll give clue this patient is having hypothyroidism or is taking levothyroxine, insulin, now present with emergency department with shock. So in infection, Addison and crisis develop. For that reason, probably this patient develop Addison and crisis. And when you will find out the 3 component hypothyroidism, diabetes, type 1 diabetes, and Addisonian disease, it is type APS type 2. So there are 2 combination. When you will find this case, it is there are some combination. I said Addison disease, hypothyroidism, both present. It is called Schmidt syndrome. And both 3, if 3 present, Addison disease, hypothyroidism, and type 1 diabetes, it is called Carpenter syndrome. So they can ask whether it is autosomal dominant or recessive. It is not. But sometimes they say it is multifactorial, but environmental, genetic, all factors related. HLA2, DR3 and DR4 involved. So APS2 is not autosomal recessive or autosomal dominant. How will investigate? For hypothyroidism, you will uh, have to do thyroid function test. So TSH will be more, T3, T4 will be low, and thyroid peroxidase antibody will be positive, anti-thyroglobulin antibody can be positive. For addition and disease, already I said, and for type 1 diabetes mellitus, that is GAD antibody will be positive. Okay, in management of hypothyroidism, levothyroxine replacement. For addition, hydrocortisone plus fluorocortisone lifelong. And for type 1 diabetes, insulin, because autoimmunity destroy beta cell. Oral hypoglycemic agent, there is no value. So in exam you will get type 1 APS is autosomal recessive or dominant. Already you can answer. What component actually the symptoms? They will give symptoms of candidiasis, symptoms of parathyroidism and Addison disease, APS1, and will in investigation we will just exclude that investigation for hypoparathyroidism, investigation for Addison disease, management antifungal, management of Addison disease, management of hypoparathyroidism. Type 2, it is not autosomal dominant, not autosomal recessive. Big glands are involved. Hypothyroidism, symptoms of hypothyroidism you will get, symptoms of diabetes you will get, symptoms of Addison disease you will get. So combination of these symptoms, when you will get, you just correlate and you say that it is APS2. Investigation related like that hypothyroidism, thyroid function test, investigation for the diabetes, investigation for Addison disease, treatment, replacement. So I think now you can differentiate APS1 and APS2, and I think there is concept you can confidently answer whatever question come in exam. Thank you very much for watching this video. My next video will be on amyloidosis and other important topics. Stay with me, subscribe me so that you can get that all videos what I upload. Thank you very much.